she's gonna help me grow my lats, and this is how we start.
We weren't gonna film this, but Chris got in position. I kind of said, wait, this needs to be on camera. So Chris lives like here, right? And if you look at him from the side, you can probably even see in the mirror how far forward he is. His entire world has referenced everything in front of him. So macroscopically, very large scale, if he does life so far in front of him, of course it's hard for him to feel things on the back of him. Does that make sense to you?
100%.
So we're just gonna go through a really, really low level just to get him feeling what expansion is here. But the first thing I wanna do is I want you to sit, you feel your sit bones or your butt bones on there?
Yeah.
I want you to sit on the back half of them without falling backwards. Now, do you see how his ribcage still has to stay up for him to find that? Okay, now drop that front side. Let go of this. Good. Lean forward a little. His body's having such a hard time sitting back because he's so used to being so far forward that he's trying to find forward still. Are you okay there?
Yeah.
Okay. Can you bring your hands supinated? Good. Come forward a little bit more. So I've got him supinated. It's going to buy us a little bit more external rotation. That external rotation is associated with expansion on the backside. Chris has done an awesome job in the last couple of days, even just letting me coach him through some of the breathing stuff and having his inhalation quiet, exhale, open mouth. That's a big deal. What I'm looking for here is expansion on the upper back. We just spoke off camera about how if he can control his lower rib cage rather than trying to train back up here, it's going to be probably the #1 thing that's going to change his back training and let him grow a little bit better. So I want him focused on controlling this a little bit. Okay. Now, Chris, when you breathe in quietly through your nose. I just want you to sense my hand. Don't force it. If you force it, you're breathing into tension. Good, and as you exhale, exhale all the way. Let those lateral ribs move down and in. Full exhale. Feel your sit bones, and I want you to feel your heels on the floor, not the front of your foot, right on the heel. If you can find the sit bone on a pull down, that's gonna help him substantially. And he's having a hard time breathing in here, but you can appreciate a little bit of scat movement on the inhalation. Full exhale. Can you feel your heels?
Yeah.
Good. And watch this on the inhale. And he's wanting to shrug. I just had him try on me, or feel me. When I inhale, if you watch my upper back, that can expand passively. Now, I expand too much on one section, but that's essentially what we're looking for Chris. So we're gonna do a little bit of testing on Chris here today. We're gonna train his back. I like to have a before and after test retest just so I know exactly what's going on with someone's pattern before I start changing anything in their training. I've seen enough photos of Chris to kind of have an idea of what's going on, and I'm a little suspicious of a couple things, but I wanna take a look at making sure I can confirm or deny or / refute whatever I'm thinking, and we'll roll the training from there. So, I'm gonna look a lot at Chris's rib cage. We're gonna be training back today, and what people don't think about often is the fact that your rib cage represents a couple of things. #1, obviously, it's a surface on which all of your back muscles sit. But the other thing it tells me is orientation of a muscle, meaning if someone like Chris's rib cage lives really forward, muscles back here are already short, or I'm gonna call that concentrically oriented. If they're concentrically oriented, oftentimes they're gonna have a hard time getting length. If you're not getting full length, you're not gonna get full contraction. And secondary to that, they can actually hold your body into a rotated position that makes it really hard to display the muscle you already have. Chris's left lat is big, but it doesn't show on his rear lat spread, and I'm suspicious it's because his whole body is already turned to the right. So when he comes into a lat spread, a good chunk of the left side is actually hidden. So I'm gonna go through a couple tests. We're gonna see if we can change that, and we're gonna roll into training. Let that rest. And let me know what you feel here. Okay. So I'm looking at end feel here, not just range of motion. End feel is going to tell me this is more of a muscle restriction, more capsular, more joint position related. The shape of the rib cage is important because if it's turning one direction, if I have a cup on the end of my hand and my hand is a shoulder blade, if the rib cage turns, the shoulder blade's going to turn with it, which is going to change the relative position of the ball and socket. It's going to tell me a little bit more on if range of motion, again, is restricted because maybe that joint isn't oriented in a way that allows it to move, or if it's more soft tissue related. He's tight. I'm gonna call that a little bit of a soft tissue restriction, but once we get to the end there, that end feel just says, that joint's not going anymore. And if I crank on it, I can, but it probably doesn't feel very good.
You can try it. Yeah, that feels all right, not terrible.
So when Chris says something feels all right, not terrible, that's most people's like, nope, don't keep me there.
Yeah.
Rest. even getting him into any degree of flexion to get him here is tough. So I know he's gonna, yeah. So that is not a tight muscle. That is a joint restriction. Does that feel different to you?
Yes.
So big difference there if you're at home and you're testing this again. He's got kind of, this is where he first starts to feel a little resistance, and he can work into that a little bit. That usually tells me there's a little bit more of a soft tissue component. When the end feel is hard like that, and it just kind of stops, that usually is the joint restriction component. Now there's a lot that this is telling me with regards to the shape of his rib cage and what that end feel is telling me. That's a little bit more of a clinical perspective, probably beyond the scope of these videos, but they do tell me, can you just let that drop?
Yeah. My pec's just tight from yesterday.
Yeah, we trained pecs pretty hard yesterday. It's probably like medium for Chris, but how does that feel compared to normal? A little tighter or about the same?
It's a little, yeah, about the same. And I mean, just because all that right there is pretty damn sore.
So when we were training pecs yesterday, Chris is so strong in his pecs. We did a little video after too where I talked about how the years of training are going to have a big influence on how his body changes shape. He's a really strong presser, so he's going to have a lot of development here, and he actually kind of stands like this at rest. That's not normal. But it also tells me about the shape of what's going on here, which is ultimately, this front of the rib cage is the same unit front and back. It just has to move and expand. His doesn't. All right, hold here and don't let me push up.
Okay.
I can't even get him in position. Ooh. All right, hold here. Ready and hold. Try not to hit myself in the face. All right, hold here. Don't let me push up. Ready and hold. Yeah, nothing. Elbow okay?
Yes, that was my shoulder to pop.
Okay. Ready and hold. Okay. Now, I'd like to look at his scat motion. I looked at that a little bit yesterday. Let that rest. I want to look at both sides because even though the left side is a problem, that whole thing is going to rotate as a unit. So sometimes being hyper fixed on the right side can contribute to left-sided issues. You okay there? So way better external rotation on this side. If you're a really big nerd, generally that means he's gonna be a little bit more compressed posteriorly on the left side than the right, which for him means it's pretty consistent that he is turning to his right. This side of the ribcage flattens out. If we can get him turning left, he restores a little curvature. Things are gonna move a little better. And that's just at rest at baseline.
Your ability to get your arm behind your back like that was super impressive.
It's because I'm a little hypermobile. That's not good either. Okay. All right, hold here. Ready and hold. One more time. Ready and hold. Okay, weak, but it's there. Now, I should not be able to push him around like this, right? Ready and hold. Ready and hold. Common compensations you're gonna see for this are someone actually feeling that in his elbow. So he had a little bit of hold there, but he's a good cheater. A lot of times that'll go straight to someone's elbow instead of lateral serratus where it should. Now, I'm gonna look at his lower body too, because I think that his whole body, including his hips, are rotating. So I don't wanna neglect this. It may change our setup for things like pull downs on rows today if I can get him on a different reference center like in his hip. I could do full range of motion testing, but we're just gonna do muscle testing. Okay. Relax. Hold here, do not let me push in. Ready and hold. Ready and hold. Not so much on that side. Nope. Okay, cool. Go ahead and bend your knees. I'm just gonna take them on a really quick, super basic, just to see if we can get any change. If I get change here, it tells me how we cue him in a session. I want your hand low. I want your pec super relaxed. Like, can you shut that off? Good, okay. Can you straighten your arm without your pec? Tricep extension without a pec, what is that? Okay, go soft elbow for me. What I'm gonna have you do is that I want you to think about taking your hand. We're gonna supinate him for the external rotation bias since we're trying to recapture. When you exhale, I'm gonna do a rib manipulation on you. When you exhale, I want you to think about just barely allowing your scap to just kind of drift forward. So So we don't want full protraction because you're gonna go pec, right? So on the internet, you're seeing a lot of these fancy biomechanics where people talk about reaching and really, really reach, and if you've lifted a weight, you're gonna go into your back. So a little bit different treating someone with a training history versus someone that's just, you know, kind of not. All right. I'm gonna have you go right arm out to the side, just to show. Yeah, good. All right. Take a breath in. Good. Breathe out through your mouth. Full exhale. Through your mouth. Good. Keep exhaling. Keep exhaling. Good. Keep exhaling. Keep going. Good. Pause for 5, 4, 3, 2. Good. Inhale as quietly as you can through your nose. Inhale. Beautiful. Good. And as you exhale, get just a light reach in the hands. Tiny bit. Tiny bit. No pec. Full exhale. Through your mouth. So what I'm looking for here is that the last portion of his exhale, there it is. The inside border of his ribs should move down and in. That's going to help restore some of the diaphragmatic position and allow the rib cage to counter-rotate. Breathe in. Now, if you're doing this at home, big mistake I see people make is thinking more is better. More activity, more work, more force, more, forceful exhale through your mouth. Good. Isn't going to be better here. If anything, you're going to generate tension and compression where you already have it, rather than the kind of coaxing the system work with you. Good. Rest. Hold here. Don't let me push up. Ready and hold. One more time. Ready and hold. That's better, but I want more. Ready and hold. There we go. Better there? Good. How did that feel on your shoulder this time?
Way better.
Yeah. I don't know if you guys can see that on camera. He's like accessing way better shoulder flexion. He's still cheating, coming out to the side a little bit. If you've got any appreciable amount of mass up here, you're not gonna have straight shoulder flexion here. You're gonna have to come out to the side. So any like textbook test is a little bit different for you if you have mass than if you don't. Okay, rest. I want more there. Yeah, rest. Good. Hold here. Ready and hold. Better there?
Way better.
Okay, cool. So the reason that's important again is that if we're setting up for back today, we want him stable. We want his hips to be able to actually provide not only some counterforce, but a frame of reference. If you can reference yourself and find yourself some stability on something like, I don't know, your sit bone when you're doing a row or a pull down, you're probably gonna have better activation through the muscle because you're actually rooted and stable onto something rather than being, kind of all over the place. Can you, like 1 out of 10 effort, press your heels down into the mat so your back is flat?
Oh, flat, bro.
Okay. Are your abs tense there?
Yeah.
Okay, let go. So rather than on, off, I want you to think about an accelerator in a car. You're gonna very, very slowly dial on the accelerator to just tip your tailbone or flatten your back. I want the back of your sit bones or your PSIS flat on that with minimal effort. Good. Okay, now I'm just gonna move your ribs around a little bit. Your job is to breathe.
Breathe.
Mm-hmm. Breathe in through your nose. Quiet. Good. Breathe out all the way through your mouth. Open mouth. Good. Keep exhaling. Beautiful. Really good. Really good. Really, really good. That just melted. Beautiful. Quiet inhale through your nose. And relax, exhale. Now this breathing stuff can be as fancy or simple as we want to make it. Out through the mouth. Open mouth. Good. Because there the ribs melt down a little bit more. Can you feel that?
Yeah.
Okay. Quiet in through the nose. Chris is doing an awesome job of keeping his inhale quiet. If you're one of these, your neck gets active, you kind of lost the purpose here. Open mouth. Long sigh. Those ribs are melting down a lot better. Good, rest. Better. How's that feel?
It's good. I mean, I'm telling you, if I wasn't tight through here, I feel like you could probably go even more.
Yeah. Move it around yourself a little bit. Just let me know how it feels.
I mean, that's just so much better. It just feels loose, right? Like when you push forward, it's like it's ran into a wall.
Yeah.
You did when I started.
Now, I told Chris at the start of the session here that he's probably gonna need to do some correctives like on his own, but then training is his way out of this. And that's, I think, you can go ahead and stand up if you want. I think that's a big misconception is people are like, oh, I need to improve symmetry. Let me lighten the load and like keep everything perfect. And that is not gonna get you, it's not really gonna get you anywhere. If your body's already referenced on one side and you're strong like Chris is, we may actually need to counter rotate you and train you into a little bit of the opposite rotation. So he'll probably have some correctives that I would give him. And for him, I look at his sternal, his infrasternal angle here. He's really, really wide, but he's also got a lot of tension up here. So it's gonna be a trick of basically finding something in sideline that's gonna let him, instead of being here where his ribs are out, compress from the side so he can increase the posterior dimension here. For his scap to move, which is what he needs for back training, if he's living in this position where his thoracic spine is really flat, scap is a curved bone. It's really hard to get curved bone movement when it's on a flat surface. So we need a little bit of posterior expansion, increased congruency so it can move. So when we're looking at correctives or even like warm-ups for someone who's shaped like Chris, meaning really wide, really forward, we want to look at something sideline to get them almost compressed in the back and allow that to move. So today while we're training, one way we can facilitate that is by giving him that reference of his sit bone, knowing that again, when we get left hip and core in position, he's got more motion. And we can actually bias, maybe induce a constraint like a yoga block or a foam roller, so he's having to stay back, hopefully get different motion. What a lot of people do, and what Chris has probably done, is instead of having full shoulder motion, he will orient himself up higher to recapture motion. So if he can go here, if he orients himself higher, he can get more perceived shoulder flexion, but he's not actually getting length in his lat. And if we want to grow lats, it has to come from actually lengthening and contracting the muscle.
Through that, like as she drove down on my rib cage, it actually felt like I was in the right position, where before that's what my normal feels like, and then to know what it feels like to be right is a big difference. Right?
It's weird. Like once you feel it, you're like, oh my God.
Yes. So I'm excited to get into this session. Look at this corrective stuff we went over here. I know I just made her do like a quick breeze through this as she can get way more in detail. Dan, do you want to tell people your information so they can reach out to you?
You can find me at Dani LaMartina, DPT, on Instagram, or Dani@teamchaponer.com is my email.
Perfect. All right, time for us to train back. If you like this video, like, share, subscribe. Until next time, Christmas TV.